John Nash, A Beautiful Mind. The movie I chose is called A Beautiful Mind, based on the life of one of the most brilliant mathematicians of all time, John F. Nash. Nash was born on June 13, 1928, in Bluefield, West Virginia. He obtained his undergrad at Carnegie Institute of Technology and graduated at the age of 19. After he accepted a scholarship to Princeton University, where he earned a graduate degree in mathematics. He had major contributions to the game theory. Nash did not start showing any signs of mental illness until his 30s, when paranoia took over a big part of his life. He was eventually admitted into McLean Hospital in April 1959, where he was diagnosed with paranoid schizophrenia. In 1961, he was admitted into the New Jersey State Hospital at Trenton, and over the next 9 years he stayed in psychiatric hospitals where he received insulin shock therapy and antipsychotic medications. John Nash's Big Five. Agreeableness. I thought even though John Nash was not much of a people person, he showed multiple times that he had a high level of agreeableness towards his wife. Agreeableness is how good-natured, warm, and friendly someone is. In the movie, Nash showed us how much he cared for his wife when he offered to take care of their baby for her, and how concerned he was for his wife's safety when he thought the Russians were coming after him. When he accepted his Nobel Prize, he claimed that if it were not for his wife, he would not be on the stage. Conscientiousness. Nash has a very high level of conscientiousness, which is how planned, organized, hardworking, and ambitious someone is. Nash reveals he is all of these things in the movie when he ends up staying in the library for 2 whole days without eating, working on his theory. He drew things he saw outside the window, like a group of guys playing football. He then would relate the drawing to his mathematical formula and to perfect his new theory. Nash was ridiculously driven. Neuroticism. Neuroticism is how anxious, tense, emotional, and worrisome someone is. It is clear throughout the whole movie Nash has a very high level of neuroticism. He clearly shows this during the scenes when he thinks the Russians are after him and his family. He freaks out and acts out through anxiousness and paranoia. His emotions are strung high and his anxiety goes through the roof. Extroversion. Extroversion is how sociable, talkative, outgoing, and confident a person is. Nash has an extremely low level of extroversion. A perfect example of this is when his only main friend throughout the movie is his roommate, Charles Herman. He also is very awkward when he tries to socialize with girls towards the beginning of the movie. Openness. Openness is how interested in new experiences or new ideas someone is, along with their curiosity. John Nash does have a good level of openness, and we see that throughout the whole movie as he involves math and numbers into anything he is doing. An example is when him and some friends are in a bar and he figures out it would be best for everyone to go up to the just average girl, so it is all fair rather than one person getting the gorgeous girl. His mind was always working and coming up with new ideas. Psychological disorder to be diagnosed. I diagnosed Nash with schizophrenia, a psychotic disorder characterized by significant disturbances in thought and emotion, specifically problems with perception, including hallucinations. The relevant DSM-V category is DSM-5. Symptom 1. Hallucinations. Nash has a hallucination of his imaginary roommate Charles throughout the entire movie. Symptom 2. Delusions. Nash has a delusion that he is a spy for the Pentagon, which is paranoid in nature because he thinks the Russians are coming after him and his family since he is cracking the codes. His missing symptom. Negative symptoms. Negative symptoms are the reduction of emotional responsiveness, motivation, socialization, speech, and movement. Other than Nash reducing his socialization, he does all the other symptoms throughout the movie. Possible treatment. Possible treatment for Nash would be antipsychotic medications. These medications work by affecting the brain neurotransmitters dopamine and serotonin. These medications do have unwanted symptoms that include uncontrollable movements, drowsiness, dizziness, restlessness, dry mouth, constipation, and nausea. Another category of medications he could use for treatment are atypical antipsychotics, which are sometimes more preferred because they pose a lower risk of serious side effects. Another way to treat Nash would be psychosocial interventions, which include individual therapy, social skills training, family therapy, and vocational rehabilitation and supported employment. Nash will have to stay on medication and therapy for the rest of his life so he maintains stable and can function in society. psychological disorders in the film. The way John Nash portrays his condition of schizophrenia in the movie is an accurate representation. He illustrates multiple symptoms correctly, and the progression of the condition throughout the movie is accurate with how it would happen to an individual in the real world. I think anyone after watching this movie would have a better understanding of the condition and would not be so afraid of it. It gives the viewer an insight to a schizophrenic's mind, and I think that is the best part about watching the movie.